Everybody, welcome back. We just completed the the how-to video on how to make a long leg fiberglass cast, and we'd like to segue that same patient and that same cast into crutch training. So I'm going to flip this. So here's the long leg cast that we made in the previous video. We've now fitted the patient with crutches. When you're fitting the patient with crutches, you want to make sure that you have 2 to 3 finger space between the armpit, the axillary space, and the actual pad. And then you want to also make sure that you have at least 10 to 12 degrees bend in the arm, so that when they use the crutches and they push off, their arm can push off without locking entirely, and it keeps the pad from giving you those really ugly bruises, those brachial bruises that you get when the pads are up tight up in the armpit. You want to make sure that the patient, I'll roll back here so you can see the patient, you want to have the crutches in an A-frame tight position where the crutches are approximately 6 to 10 inches outward, and not like the letter I where they're up close and the patient can tip over one side or the other. And then you want to do some basic crutch training with the patient. So you teach them to do a half turn. Go ahead. Yep, just as far as their hips will turn. And then straighten out, then half turn again, all the way to you're facing the opposite direction. Get yourself set up, get your crutches in the right position, and you teach them how to swing their good foot past the crutches about a good 10 to 12 inches each time. So go ahead and proceed forward. There you go, keep on going. Basic crutch training. Another good trick, keep going, and then we'll have you turn around in just a sec and stop and do a half turn back towards me. And come on back. Another good tip to tell the patients or the kids is however far the crutches go on their own without you having to reach is a good stopping point. A trick that I use, if you're in an exam room, come on in for a sec, and go ahead and line yourself up with these square tiles on the floor. Another trick I use is I teach the patients to line up the crutches with the first line on the floor, and then when they swing their good foot, they swing it to the next line. And then the crutches to the following line, and then the foot to the line after, etc., etc. It's a good little 10 to 12 inch rule that they can apply to. Go ahead and spin around, half turn, or whole turn. And that is your basic crutch training to go ahead and go with the short or long leg cast. Thanks for watching.